Recording has started. You guys are ready to go.
All right, perfect. So good afternoon, everyone, and welcome to IRHA's March Lunch and Learn. Today we have back our alums from our 2019 fellowship class presenting upon the vaping and e-cigarette epidemic. As part of their fellowship, they had researched this topic last year and presented to our board in December. Through this fellowship, IRHA aims to expose students and young professionals to a variety of topics relevant to public health and also rural health care. It has been a joy to work with them, and with that being said, I'm going to introduce the fellows and I'll let them present, take any questions. So first, we have Desmond, Desmond Atem, Doctor of Nursing Practice at St. Mary's College, Notre Dame. We have Katie Lugar from a Doctorate of Health Sciences from Indiana State University. We have MacKenzie Whitener, and she's an MPH candidate, Social Behavioral Sciences and Health Policy Management, and also a program manager at the PRISM Lab, Prevention, Research, and Substance Use in Minority Health at IUPUI. We have Mitch Western. He's a Franklin College alum and works at Decatur County Memorial Hospital. And we have Lara, an adolescent health educator with Life Smart Youth. We have Dr. Mullen as well as a mentor with the Policy Research Development Officer here at IRHA, and myself, Taylor Kenyon, who is the Tobacco Prevention and Cessation Quality Advisor with IRHA. So with that being said, take it away, fellows.
Okay, thanks for everyone who's joining us today. You can go ahead to the next slide. Here we just see an overview of our project, what we aim to do over our fellowship time together. We wanted to look at e-cigarette trends and the usage in rural Indiana, try to connect those things together. We've looked at data with web trends and news trends and how that relates to the recent health outcomes. We identified the factors for youth use that has increased with e-cigarettes. And then we also, after looking at the data, tried to figure out what we could do or some possible solutions, looking at social media campaigns, the influence of social media as it stands with young people, policies that are in place or are up for consideration, and making recommendations moving forward. You can go to the next slide. So to start us off, just a quick definition. So we have an understanding of what we mean when we say e-cigarettes. We are talking about battery-powered devices that deliver aerosolized liquid to a user. That liquid can contain nicotine, different flavors, and other chemicals. We know that e-cigarettes contain more nicotine than a regular cigarette. They are easier to smoke, and that is part of the appeal for young people. The popular brands you might hear are Juul, Fix, and Soren. Those are some of the popular ones. And we know that there are a variety of flavors and different types of marketing, which we'll see in the future, or I'm sorry, later on in this presentation, along with some other policy changes. Thanks. You can go to the next.
So a little bit of a background. So obviously the nicotine and e-cigarette use increased during our project, but a little bit of a background on how we got there and what we've got going on here. So tobacco use among youth and young adults in any form, including e-cigarettes, is not safe. In recent years, e-cigarette use by youth and young adults has increased at an alarming rate. E-cigs are now the most commonly used tobacco product among youth in the United States. Recent increases in the use of e-cigs is driving increases in tobacco use among youth. The number of middle and high school students using e-cigs rose from 2.1 million in 2017 to 3.6 million in 2018, a difference of about 1.5 million youth. Current past 30-day use of e-cig went up among middle and high school students from 2011 to 2018. Nearly 1 of every 5 school students, 20.8%, reported in 2018 that they had used e-cigarettes in the past 30 days, an increase from 1.5% in 2011. Young people that use e-cigs are 4 times more likely to use combustible cigarettes. Indiana has 6 confirmed cases of lung-related issues due to vaping. Next slide. So we've got a little bit of visualization here. You can see from 2012 to 2018, cigarette use did in fact decrease, but e-cigarette use increased by nearly 400% from 2012 to 2018 in high school students. In middle school students, you see the same correlation of cigarette use decrease. Unfortunately, you see the same in e-cigarette increase. So from 2012 to 2018, you see an increase of nearly 360% from 1.2% to 5.5%. On the right, you've got just a little bit of an infographic on the type of any tobacco or tobacco products used among high school students in 2018. It ranges from left to right there. To any tobacco products, about 27%. E-cigs right there, 20.8%. Down on the list. Next slide. So the basis of the data and the project here is to try to correlate the amount of smokers in Indiana and getting an increase, and correlating that to the increase of youth using e-cigarettes. The trouble that we had was mainly due to the fact that 2019 was a high trend point for this topic. So data was a little bit scarce. So we really were trying to correlate high use of smoking data and rural county data. So this national data here is showing adults who are current smokers, and this is from 2017, and Indiana is in the dark blue, which is one of the higher rankings there, 19.9 to 28.0. Next slide. So kind of to further that conversation, you can see here these two infographics. We've got just the county list of Indiana, and that's showing on the left side the percentage of adults who are current smokers. And on the right side, you can see where our more rural urban communities are from counties. So if you just take a look at the picture, you can see the darker blue, which is showing an increase of percentage of adults who are current smokers. It is relatively correlating to our rural counties there. Next slide. This was as of November 19th, 2019 from the CDC. And this is just showing the number of lung-related injuries cases per state. I didn't have a chance to see if this had been updated at all, but at that current state, Indiana was relatively high in case count from a national data standpoint. Next slide. So furthering on that next previous slide, this one here tends to just show hospital admission from patients with lung injury associated with e-cigarette use. You can see the increase of admits typically around September there, and then it starts going down. I did have a chance to look at this infographic, and that trend did follow the decrease. December and January looked relatively low, so that is good. Next slide. So a little bit of summary. E-cigarette use among youth has significantly increased since 2012. About 1 in 5 high school students reported currently using any tobacco product. From 2012 to 2018, e-cigarette use in middle and high schools has increased about 350%. 64.6% of youth that are using vaping products are using flavored vaping products. Next slide. Do we know if Desmond's on the call?
I do not believe so.
Okay. I mean, I've got the slides here. I can keep going if you want.
Keep going.
Okay. So Desmond, he looked at a few of the health impacts here. Electronic cigarettes are a significant threat to public health. The Food and Drug Administration has not approved these products as a safer alternative to traditional smoking or smoking cessation. Nicotine is a highly addictive substance. The use of such products puts adolescents at a higher risk of becoming addicts. Addiction is a serious but preventable disease. Next slide. This is just an infographic on what e-cigarettes what they do to your body and what's going on after you vape. from Yahoo Health. Next slide. So here's a nice quote. Although many young people believe that the use of e-cigarettes will prevent them from using traditional cigarettes, the evidence was quite the contrary. A peer-reviewed research study indicated that adolescent e-cig users had a high propensity of conventional cigarette use. Next slide. So health impacts continued. Recent studies indicate that the use of e-cigs has shown to cause very similar cardiac and respiratory changes as seen with users of traditional cigs. The presence of ingredients such as volatile organic compounds, heavy metals, flavorings, and other ultrafine particles have been linked to severe lung disease. Research suggests that electronic cigarettes interfere with healthy brain development, and users commonly suffer from mood disorders, poor impulse control, and behavioral issues. A cross-sectional analysis of some day and everyday e-cigarette use are associated with increased risk for myocardial infarction, adjusted for combustible cigarette smoking, demographic, and clinical variables. Next slide. So this is a nice infographic here. It's just showing that the growth in e-cigarette use. You can see the percentage of youth who use e-cigarettes has increased from 2011 to 2018. You've got the dotted line being high school students, the full line there being all students, and then the not as dashed line being middle school students. So they're all following an increase in trend there. So we need to start trying to reverse this. Next slide. So during our study here, it was kind of fun, mainly due to the fact that it just kind of took off midway through. So we wanted to try to show, just from a Google Trend standpoint, what searches that we're looking at and according to our topic that we were researching on. So you've got electronic cigarettes there on the top right in the blue, vaping in the red, vaping death in orange, and Juul, and I think it's another, oh, it's green, sorry. You can see really about midway through 2019, it really started to increase, and then it started going down, and it did follow that trend. Everybody has kind of stopped searching these web terms, and definitely in light of recent health scenarios right now, but you can see right about mid-2019 when we started seeing hospital admissions, it really took off. Next slide. So we also took a little bit of a data dive here into some news articles or news headlines. You know, when did Indiana know that e-cigarettes might be a potential issue to any tobacco user, or even our youth? So left there, you've got how is Indiana handling the growth of the e-cigarette market, and that's dated May 2nd of 2014. Right side was more during our study here. E-cigarette maker Juul facing mounting scrutiny from state attorney generals. That was August 30th of 2019. Juul stops e-cigarette ads as teen vaping illnesses grow. That was also around the middle of 2019. And then Hoosiers file lawsuit against e-cigarette making Juul, claiming deceptive marketing and health issues. So the real point we're trying to make here, the companies we're currently manufacturing and selling the e-cigarette solutions in over about 7,000 unique flavors prior to any sort of regulation. So in 2016, 59% of high school e-cigarette users in Indiana had used the e-cigarettes. E-cigarette marketing often involved tactics previously shown to increase the appeal of tobacco products to youth, including celebrity endorsements, sports, music sponsorships, and themes that resonate with the youth. Nationwide, about 7 in 10 youth were exposed to e-cigarette ads in 2014. In 2016, about 2/3 of Indiana high school students, 67%, reported exposure to e-cigarette ads. So the whole point of having this slide here is just to kind of show the lag of what we have from a marketing standpoint, from Juul companies and our news representative and what we're doing legislatively to try to prevent some of this. So next slide, please. So in light of that, this slide here kind of showed Indiana counties there on the left with tobacco-free public school districts. And that would include all school districts tobacco-free, some school districts tobacco-free, no school districts tobacco-free. So this is dated 2017, so 3 years after we knew about any sort of nicotine and e-cigarettes. We're doing a pretty good job from a tobacco standpoint. If you look at the right graph, it's including e-cigarettes. So the red is saying no districts include e-cigarettes. Yellow is some districts include e-cigarettes. And the blue is all districts include e-cigarettes. So quite the discrepancy between when, as a community, we knew about e-cigarettes, and from a even news standpoint, we were getting informed about it, but it just wasn't really communicated to legislation and our school districts. So, I mean, when you've got the flavoring and whatnot, it really was a good marketing technique. Next slide.
So when we went to look at some of the marketing that was out there, we know that it can be very targeted toward teens, kids, and young adults. This slide here has an example basically saying that the industry has a kids menu. You can see that the flavors involve candies, nerds, lollipops. That one says vape jam, mimicking a label of a popular jelly or jam company. But these bright colors and flavors really attract young people. Next slide. We have more examples here of specific flavorings that are available. The two I want to point out are on the top row. The far left says Watts apple juice, which just looks very similar to the Mott's apple juice brand. In the middle is a Trix flavoring, although they spell Trix differently than the cereal. It's a play on words here, and if you remember, that cereal brand slogan is "Tricks are for kids." So these bright colors and attracting flavors, popular candies that these are mimicking really attract young people. Next slide. Here we also know that these companies in the e-cigarette world are also targeting young people in other ways, using social media, using celebrity imitation. The top left is an older ad from Juul, one of the companies we've been talking about. And to the right, you see vaporized, which is a catchy slogan, and a young person behind the word mimicking the signature pose of Ariana Grande. So the pose, the hair, the ponytail, that's kind of Ariana Grande's look. And she's a very popular person out there right now for young people. So they're mimicking her in that advertisement. To the right are Kylie Jenner and Sophie Turner, both very popular influencers. Now, neither of them are paid to promote e-cigarettes or vaping products, but we know that they are using these tools regularly on their social media posts, which add to the influence that they have among young people or the followers on social media. And then we have an example here of a race car that's sponsored by Blue, another company in selling electronic cigarettes. Next slide. So we know that social media has a large influence on young people, and we're starting to look at how we could make an influence, how IRHA can make an influence, how people can make a positive influence using social media around vaping. We know that the three most common forms of social media used by young people are Snapchat, YouTube, and TikTok. Instagram is also very popular. Among young people, it's important to realize that these four different types all involve images and videos. I think a lot of people still think about traditional outreach in text. You do see we have Facebook as one of the logos in the bottom left, but young people will tell you Facebook is for old people. That we know that might be a good opportunity to reach parents, potentially using school district parent groups or community groups or neighborhood groups that might have connected on Facebook, we can use that as an outreach tool. If we're thinking about posting for young people on these social media platforms, you can use different tools to schedule out posts so that they don't have to be live posts. These tools like Hootsuite allow you to schedule for prime time for teens or young people. Data shows that most views happen before school, during lunch, and before bed. So using those tools to schedule out posts would be effective. And we also know we can partner with school districts that could share IRHA's posts on social media in order to reach a larger audience. So when we were thinking about social media and what IRHA could do, or these next steps for this social media campaign, our fellowship team member MacKenzie made some examples for us. So if you could go to the next slide. These are images that could be posted pretty easily to Instagram. They're already in the square format, and Instagram allows for multiple images. So a bright, catchy color like the image on the left would be the first one, and then they could swipe to the right to get the answer. We know that a lot of young people think that vaping is safer because of the lack of tobacco or the tar that might be in there. They don't really understand the effects of nicotine and why nicotine is important to understand the impacts around health. So if we aimed the marketing images or that social media campaign around understanding nicotine, that could be really beneficial for educational purposes. So next slide. We also, MacKenzie put together these images to really call out the what's inside the pod. So we know that young people might be consuming several pods a week based on self-reporting. Adolescents say that they might be smoking 1 to 5 pods electronically through these e-cigarettes. And young people need to know how much nicotine that is. So the image on the far left shows you that 1 jewel pod is the equivalent of about 2 packs of cigarettes for nicotine content. Fix, which is another popular brand, would be 4 packs, and Soren would be about 4.5. So, calling to light the importance of nicotine, the impacts of nicotine, and just understanding exactly what people are putting in their bodies could be really beneficial. And when you think about kids smoking or consuming 1 to 5 pods a week, that's a lot. And you can see that with that high consumption of nicotine, that these devices are not necessarily going to be easy to use for quitting or getting off of the use of e-cigarettes. Next slide. So this is a quick summary of the Surgeon General report that came out earlier this year that basically says we know that the FDA has not approved these e-cigarettes as an aid for quitting smoking. That research needs to be done. So that kind of goes back to what I was just saying. And it very clearly states that e-cigarettes are not safe for youth, young adults, pregnant women, or adults who do not currently use tobacco products. So this is really important that the Surgeon General has made these very clear statements in light of all the data that we're collecting. Next slide.
Hi all, this is Katie. We did have a question pop in that I would like to address real quick. So a question was asked if we could discuss vaping leads to using other product and or polysubstance use. And there is research, that tells us that for youth and young adults who use e-cigarettes, they are 4 times more likely to begin using traditional combustible tobacco products like regular cigarettes. But we also see increase in polysubstance use. There is some research that for people who maybe for people who might be using cigarettes, they might have an idea that e-cigarettes can be used as a cessation device. However, what we've been seeing is that people are not fully achieving their cessation goals or complete abstinence from using cigarettes. And what we see is that they might be using e-cigarette products but they continue use of that e-cigarette product while also continue to use cigarettes. And so, and there's other information on that as well, but I just wanted to address that question real quick. So I'd like to go into current policies have been enacted as of December 2019. And so we vary based on different state policies, but I'm going to focus on Indiana for now. So all states have laws defining e-cigarettes now, and that has been included in some federal movements as well. But Indiana is one of 24 states which classify e-cigarettes as tobacco products. Working on a university campus, we have students who always have questions, well, are e-cigarettes tobacco products? What's our policy like? But Indiana does classify e-cigarettes as tobacco products. There are also definitions for what these products mean. So Indiana policies do include definitions for electronic cigarette, electronic delivery device, nicotine liquid containers, e-liquids, and vapor products. And all of that information is available. That basically just discusses products that contain nicotine or their intended use for these different electronic delivery systems. We do see that 22 out of 50 states have a law taxing e-cigarettes. However, Indiana does not. There are no laws mandating any excise or special taxes or non-sales taxes on cigarettes. 29 out of 50 states have laws on product packaging of e-cigarettes. So Indiana passed product packaging requirements in 2015, but basically this comes down to nicotine liquids and gels must be sold in child-resistant packaging, except pre-filled containers not intended to be opened by the consumer. And manufacturers must also use e-liquid containers with tamper-evident packaging, a child-resistant cap, or other different requirements, basically to prevent children from opening up and accessing these products. And now I'll talk on the next slide of Tobacco 21, but we do see that all states now will have laws on youth access to e-cigarettes. So right now, Indiana operated off of the minimum age of purchase law of 18. And so that will change to 21 once we have all of that implemented from the federal level down to the state level. So looking at the 18 age, sale and distribution of electronic cigarettes was restricted to anyone under 18. That will change to 21. Same for sale of e-liquids. Same for possession and purchase of electronic cigarettes. And we also see that self-service displays, vending machine sales of e-cigarettes are not supposed to be accessed by anyone under the age limits. We're basically seeing more regulation on manufacturers, distributors, and retailers, and they are prohibited from marketing e-liquid as a modified risk product because they do contain risk. And we have to look at manufacturers specifically within their mixing, bottling, and packaging processes and sale of liquids, because they are also restricted to persons without proper permits. And that is important as well. So we have 28 out of 50 states which have laws on retail licensure on e-cigarettes. Indiana is included, so a retail license or permit is required to sell any e-cigarettes. And of course, that must comply with the minimum age of purchase laws. Statewide, we don't have smoke-free restrictions for e-cigarettes. However, we do see individual policies happening across different institutions. And for instance, school systems, universities, colleges, businesses, things of that nature. Interestingly, Apple products decided to ban all vape vapes from the Apple Store. So this occurred in November 2019, and Apple banned all vaping apps from the App Store by removing 181 apps related to vaping. So they never actually allowed the sale of tobacco or vaping cartridges through the App Store. However, these apps were a mix of games, hardware companion apps that basically let users regulate and modify their e-cigarette products so they could change things like lighting and heating of vape pens, which could impact the liquid, the nicotine, and those chemical reactions, specifically with the heating of the vape pens. People who had already downloaded the apps can keep them. They've basically been grandfathered in. People are not allowed to download any apps now that they have removed them. But we've also seen other companies take action to pull e-cigarette products from their shelves, especially now that we have seen increases in lung injury related to e-cigarette products. So businesses like Kroger, Walgreens, and Walmart, as well as Rite Aid, discontinued the sale of e-cigarette products. Next slide, please. So with regard to public policy, we are seeing movement at the federal level, which is very encouraging, also an interesting piece to this as well. So in January 2020, the FDA implemented or prioritized enforcement of flavor bans. And so basically they are prioritizing enforcement against certain unauthorized flavored e-cigarette products that appeal to kids, including fruit and mint flavors. So companies that do not cease manufacture, distribution, and sale of these authorized flavored cartridge-based cigarettes, other than tobacco or menthol, risk FDA enforcement actions. One of the largest movements that we've seen is the federal tobacco age to 21 change. So this raised the minimum age of purchase to 21 for all states. While this was enacted in December 2019, there is some lag time for getting all of the states on board and actually implementing and enforcing this policy. So this piece of legislation was actually passed through Congress's $1.37 trillion spending bill that ended up raising the minimum legal sales age for all tobacco products 18 to 21 nationwide. So what we're seeing now is that it's a violation of federal law for any retailer to sell any nicotine or tobacco products to anyone under the age of 21, which is interesting. I think we've actually had issues with this before, and there's advocacy work surrounding this where youth were punished more harshly than the actual real retailer. So from what I understand, youth could face up to a fine of $500 for purchasing a tobacco product if they were underage, whereas the retailer only faced a fine about $200 for selling to someone who was underage. And there is work to change this as well. So basically, they are taking time doing this. It could take anywhere from 270 days since this was enacted for the FDA to actually enforce the new age. The advocates for Tobacco 21 were very encouraged and grateful basically that this piece of legislation was passed. However, there is some general disappointment in the enforcement structure. And basically the fear is that unless the FDA, cities, or states increase enforcement against retailers, the effect of the law will basically be diminished. And we also see that just this law alone, as with any policy addressing a public health issue, it can't be the only way that we're addressing this crisis. So we want to make sure that we are also incorporating tobacco retailer licensing laws, flavor ingredient restrictions, limits on high-dose nicotine salts, and internet sales prohibitions in order to have a more comprehensive way to address e-cigarette use and tobacco use, particularly among youth. So looking at Indiana, we do see some movement as well for enacting and actually enforcing and following through with raising the minimum age of purchase. So Senate Bill 1 is currently active, and this is looking at prohibiting persons less than 21 years of age from buying or possessing tobacco, e-liquids, or electronic cigarettes. So they are really making sure that they are focusing on retailers and seeing that they are subject to civil judgment for any infractions or violations of this law. And so basically they're just moving forward with the federal legislation and implementing on a state level. It does also include information about packaging, retail licensure, and other requirements as detailed earlier. House Bill 1205 looks at smoking and vaping restrictions as well, and is specifically looking at raising the minimum age of purchase 18 to 21. So this is all similar to what we're seeing overall. On a federal level, they are looking at protecting American lungs and reversing the Youth Tobacco Epidemic Act of 2020. So basically, this looks at revising requirements related to the safety, sale, and advertisement of tobacco products, including electronic nicotine delivery systems. So whether it's e-cigarettes, e-hookah, e-cigars, and vape pens, they're trying to do a cover-all with these different products. So they're looking at implementing regulations to require color graphics on the labeling of cigarette packages and actually depicting the negative health consequences of smoking. They want more regulations on tobacco products, including e-cigarettes. It looks at prohibiting the online sale of tobacco products, including e-cigarettes, and actually making sure for some businesses who sell their products online that if they are selling this product, basically the purchaser needs to prove that they are of age and would have to show their ID in order to receive the product. And they go on to list quite a few other things and their goals with this bill. And then lastly, jumping back to Indiana, their Raise It for Health campaign is looking specifically at increasing the tax on cigarettes and tobacco products. And so they are specifically a grassroots effort looking to raise the cigarette tax by $2 per pack. And basically, this would result in approximately $300 million additional state revenue annually. While a bill was not introduced in 2019, the group has mobilized their members for a 2020 campaign, and they're going to do so again in the future as well. Next slide.
So when we put all of this together, we came up with a series of recommendations for how we can be doing more in Indiana to really tackle the issues with e-cigarette use, particularly among young people. As Katie was just explaining, there are several policy options that people can support. We were just talking about taxation. If you look at the chart on this slide, you can see highlighted by the red boxes that there is no tax in Indiana for the e-cigarettes. So that is definitely an opportunity, getting behind the grassroots movement with Raise It for Health. We know that we can continue looking at marketing, looking at the policies and regulations around marketing, what that looks like in certain places, like if we continue to see marketing or people pulling product from their shelves, limiting the visibility of these products. And then another option for policies is looking at those comprehensive school policies. As Mitch was showing earlier with the chart of Indiana counties, there are many Indiana counties that do not have school districts that include e-cigarettes in their comprehensive, in their school policies for tobacco or drug use on campus. So we know that there's opportunity there to increase the breadth of, or the reach of those policies to include e-cigarettes. I also added 2 high schools on this slide that are kind of current events to keep our eyes on just this year. Starting with Mishawaka High School up north by South Bend. They released and started, a press release that talked about their new policy enacted this year to begin fining students for using e-cigarettes or vaping tools or devices on campus. That fine is $145 per incident, and that is at their school resource officer is able to issue that fine to students. So when we're talking about comprehensive school policies, it's also very important to understand and to consider the follow-through, what impact that might have on young people, what impact that might have for consistency's sake, and who's enforcing it, and those types of things are very important to consider because of things like what happened at Madison Consolidated High School. So just this year, in February, Madison Consolidated High School down south had 14 hospitalizations of young people for vaping on school campus. So actually 2 of those who were taken to a hospital were not students, they were teachers. And we know that some of those students were repeats. So they had been sent to the hospital for sorry, the words are escaping me, for a checkup to see what was happening, and that later in the month they were sent again. So students were sent to the hospital with symptoms of increased heart rate, dilated pupils. There was one case of loss of consciousness, and the investigation of the vaping devices is going into the cartridges and the e-liquid that was used. And they've identified 3 chemicals, but have not released what those chemicals were. And the school officials have very explicitly mentioned that these devices were being purchased online. So when we're looking at policies like raising the age for access in the United States, we still need to consider, you know, where then will people get these devices, get the liquid? Are people building their own to refill the devices? All of these things need to be taken into consideration. So keep our eyes out for these school policies and how schools choose to respond to incidents that are happening on their campus. Next slide. When we look more broadly beyond just those policy options, what else folks can be doing, including what the recommendations we made to the IRHA board were, is to somewhat mimic the Indiana State Department of Health 3-prong approach. So ISDH, their approach includes prevention, public education, and cessation resources, and IRHA can continue to kind of mimic this with advocacy, lobbying, and partnerships. So we can talk about advocating for policies, advocating for education through social media. We can, in public resources, these types of things, lobbying for policies on a federal or state level, but also really encouraging and advocating for more local policies, like the ones in schools, or even ones for smoke-free zones in certain counties. We know that there can be partnerships with educational programming. ISDH supports the Catch My Breath educational tool, which is specifically for young people. It's an educational program, a series of programs supported by experts in the field, and that specifically calls out vaping. So a lot of educational programming might talk about alcohol and drugs, but not necessarily specifics around vaping or electronic cigarettes. We encourage the board to increase the social media presence that they have to publicly take a stand, to make, like we had those social media images created, and to seek out influencers who, if we know that they can have a negative impact, find people who can also have positive impacts. So looking for local celebrities or folks who might be able to be on board with a social media campaign for the positive here. We also added down here a link to the tobacco prevention and cessation page under ISDH, where folks can connect and become aware with their local tobacco or nicotine coalitions for people who are doing the work already in their areas. So get involved, support them, and see what difference we can make. We know that there's a lot still left to be done in Indiana, and we know IRHA can certainly be a part of that. So next slide.
Perfect. Thank you very much, fellows. I know we're getting to the top of the hour, but I just wanted to thank you all for coming back to present to us since the December presentation to the board. And likewise, thank you to the attendees asking the thoughtful questions. So this webinar was recorded and will be in our IRHA archive webinar section of our webpage. But that is the conclusion of our March Lunch and Learn. So again, appreciate it.